Hello, this is Medicine in the World channel, and I am Dr. Erin Sharp, an oncologist at St. Jude's Children's Hospital. Today our topic is cancer side effects. I have decided to bring in 2 cancer patients rather than medical professionals to acquire a different point of view. Here with me is Ms. Megan Gray and Mrs. Jane Crossley.
Hello, I'm Megan Gray. Hi, I'm Jane Crossley.
Welcome to the channel. We are so glad to have you with us. To start off, can you both tell us a little bit about your cancer?
I have a CNS lymphoma, which is a type of brain tumor. This type of cancer affects everyone differently. For me, I've experienced headaches, seizures, and blurred vision. I have a carcinoid tumor, which is a tumor located in my colon. I have experienced abdominal pain, facial flushing, and rashes, all of which are very typical of a carcinoid cancer.
Okay, thank you. Now can you each name what cancer therapy you have chosen so that I can go into a little detail about the technology for each one?
My doctor and I chose to follow the path of radiation therapy.
I am currently being treated with chemotherapy.
For those of you who are unfamiliar with what exactly these cancer therapies are, radiation therapy is the usage of very high energy radiation to shrink the tumor and hopefully kill the cancer cells. The radiation itself is either delivered by a machine or a radioactive material placed near the body. Chemotherapy is very different. Doctors use anti-cancer drugs to both destroy cells and prevent them from growing and dividing to make more cells. Now, both of these therapies are very harsh on the body and come with a variety of different side effects. Could you both, if you are comfortable, give us a few examples of side effects that you have experienced?
So with my treatment, the radiation is localized to my stomach. This means that my side effects are not extremely severe. I have only experienced some mild rashes around the area of applied radiation, accompanied with some nausea and vomiting.
My treatment is a little bit more aggressive due to my type of cancer. I have a much larger dose of drugs every appointment, so I have experienced a fair amount of effects of the therapy. I have experienced nerve damage, which is a kind of burning sensation in my fingers and toes. It also causes me to be very weak and lose my balance a lot. The drugs have also reduced the amount of blood cells I have, which has left me with a condition called leukopenia. This means it is very easy for me to get an infection.
Thank you both for sharing your personal experience with each treatment. Now, there are a handful of ways to counteract or treat these side effects. Have either of you been given instruction on how to handle these side effects or been given any medical aid?
I have had to do a lot to combat my side effects. Because of my nerve damage, I am taking a medication to help with the burning and weakness. I have had handrails put into my bathroom so that I won't fall. I'm also taking a nerve blocker to help the pain and a medicine to stimulate the production of white blood cells to help my leukopenia.
My doctor put me on a medication to help alleviate some of the nausea and vomiting, and I have changed my diet significantly to help prevent weight loss. I also drink a lot of high-calorie and protein beverages and try to eat high-calorie meals to make up for the fact that it is hard to eat a lot or keep anything down.
Thank you both for being so open. My hope with this podcast is that those who are in situations similar to yours will take comfort in knowing that others are out there and they are not alone. I think something that most people don't realize is that by succumbing to the disease and giving up on all the little things in life is really what helps the cancer grow and makes your health worse. It is encouraging your body to deteriorate if you don't keep fighting. Cancer doesn't have to be a jail sentence. You can keep living as long as you fight. Thank you both so much for coming in today and sharing your stories. It is very special to have this information to share with those out there just like you. This is the end of today's episode of Medicine in the World. Thank you all for listening. Next time, there will be an interview with an orthopedic surgeon on how you should act to keep your joints young and healthy.